بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله ومن والاه أما بعد. Chapter 9 أحكام العبادة الخاصة بالمريض والطبيب, the rules of worship relevant to patients and doctors. So we're talking about four kinds of ibadat. أولا الطهارة, ثانيا الصلاة, ثالثا الصوم, رابعا الحج. So firstly we have Tahara, and with Tahara we start off with أحكام التيمم. Okay? We already established this multiple times that the Sharia is based on ease and simplicity, al-yusr wa suhula, right? And so Allah subhanahu wa ta'ala, because of that ease and because of that facility, grants those people with legitimate excuses, valid Shariah excuses, He gives them ease according to their difficulty, according to their problem. So they can also, without any haraj, be able to perform their acts of ibadat. Right? Surah Al-Hajj, verse 17, وَمَا جَعَلَ عَلَيْكُمْ فِي الدِّينِ مِنْ حَرَجٍ. And Allah has not placed upon you in religion any difficult. And so if a patient, is unable to make wuzu because of, let's say, a hadath, minor ritual impurity, or because of bathing in a major impurity, it could be any reason. It could be either because they are physically incapable, or because there's this fear and chance that using water might worsen their situation, delay the recovery, or even result in, the loss of a limb, or in the most severe cases, loss of life. So in any of these situations, one can perform tayammum by striking the earth with their palms, wiping it on their face, and wiping their hands up to the elbows. And so Surah Al-Ma'idah, verse number 6, Allah subhanahu wa ta'ala mentions this entire thing. وَإِن كُنتُمْ جُنُبًا فَاتَّطَهَّرُوا وَإِن كُنتُمْ مَرْضَىٰ أَوْ عَلَىٰ سَفَرٍ أَوْ جَاءَ أَحَدٌ مِّنكُم مِّنَ الْغَائِطِ أَوْ لَامَسْتُمُ النِّسَاءَ فَلَمْ تَجِدُوا مَاءً, and you don't find water, فَتَيَمَّمُوا صَعِيدًا طَيِّبًا, then seek clean earth and wipe over your hands and your face. So it mentioned this ayah both minor impurities and major impurities. If you have them and you don't have access to water or you're sick, then you can do that for them. Similarly, the one who's unable to use water has the same ruling as the one who cannot find water, right? Ammar ibn Yasir, radiallahu anhu, he reports that the Prophet ﷺ said, it should have been enough for you, the tayammum should have been enough for you. He struck the earth with his hands once, then shook them and wiped his face and his palms. So what happened was they were in a safar, they were traveling, Ammar ibn Yasir and the other Sahaba, and it was very cold up in the night, and Ammar ibn Yasir, he got in a state of janaba, right? So he ejaculated, now we're in a state of janaba. Till now, the ahkam of tayammum were not very clear, or they weren't revealed yet. And so what he did was, thinking that in janaba I would have to wash my entire body, and so he made a prayas that he rolled over in the sand, completely covering himself in dust. And then after the whole event was over, they came back to Medina. He came to the Prophet of Islam, told him the situation, on which the Prophet of Islam then taught him the proper ahkam of them. That it is sufficient to wipe your hands and your face. Right? And so obviously over there, he could not use water because it was very cold and he feared that he might perish if he did so. And so it was allowed for him to do it. Now let's talk about the different scenarios that pertain the use of tayammum. So, like we mentioned, different stages and different forms of sickness and disease uh, will hold different ahkam. It's not just if you're sick, any type of sickness, you can use tayammum, right? So, for example, scenario one is the patient is only mildly sick. That means that the use of water is not going to lead to death or severe sickness or delay any recovery or increase the pain of whatsoever. Like ailments including headaches, toothaches, etc. And then in this case, if they're able to use water without any harm, they must do wuzu. It would be impermissible for them to do that. Okay, the only reason them was ever mubah and allowed in the first place, لنفي الضرر, was to remove any harm. And if there is no harm, then a person is obligated to use water to gain Taharah. But obviously, the second scenario is if the patient has a condition that entails the risk of death or loss of an organ or limb or further sickness, it's going to increase. That might potentially lead to the loss of an organ or limb, or might even result in the forfeiting of a benefit. So you have your eye, for example, but it's not functioning, or your hand and it's not functioning, such a disease, right? Then in this case, you do tayammum. You don't do wuzu, you do tayammum. Because Allah subhanahu wa ta'ala mentions in Surah Al-Nisa, verse 29, وَلَا تَقْتُلُوا أَنفُسَكُمْ إِنَّ اللَّهَ كَانَ بِكُمْ رَحِيمًا. Do not kill yourselves uh, or one another. Indeed, Allah is to you ever merciful. Third scenario is that a patient is suffering from an immobility, right? I mean, they can't move to do wuzu, neither do they have a helper to bring them water. Then in this case, it would be permissible for them to perform tayammum. Or if they have someone, then the first thing is that someone should help them to wuzu. But if it's impossible, either condition is so that even someone else can do it, or you don't find someone else to help you with, then you can do tayammum. And if you can't do tayammum as well, I mean, you can't use water, you can do tayammum, but you are immobile to the state that you can't even do tayammum yourself, then someone else can help you do tayammum as well. That is also a possibility. Case number four is if someone has a wound, fracture, a sore, or any disease of sorts, right? And causing water will harm them, right? And then that person enters in the state of janaba, then it is permissible for them to do tayammum, right? What they should try is, if it is possible for them to wash their body, except for that injury or fracture or sore or disease, that part of the body, they cover that up, wash the entire body, which is uncovered, and then wipe over that uh, diseased place, that ailment, that fracture, etc. Then that is the best possible thing to do. But for some reason that's not possible, then that person can perform tayammum. So these are the different scenarios in which you can perform tayammum. The principle of tayammum, as you studied in class in fiqh, is that tayammum is nullified by all those things that nullify wudu. Add to that that it is also nullified if a patient who was previously unable to use water now becomes capable. That can either be because water was not available and now it's present, or that the person was sick and could not perform wudu, and now they're healthy again, right? So these are two extra things that would break your tayammum, along with all those other things that break wudu. Allahu Alam. This is related to this, are vaginal discharge, right? So this is a white, sometimes colorless substance whose texture varies between that of preseminal fluid, molly, and that of sweat, right? And it usually is discharged from the inner pharynx or the vagina, right? Now, vaginal discharges are of two types. They can either be natural, which normally happens with women, or it's pathological. It's determined by an underlying disease, right? And they both have the same ruling, though. So, firstly, in terms of purity and impurity, the Rajah jurisprudential opinion is that vaginal discharge is pure. And the evidence for that is the riwayah of Aisha radiallahu anha that is mentioned in Sunan Abi Dawud and Nisa'i. أي كنت أفرك المني من ثوب رسول الله فيصلي فيه. She mentions that the money that I used to scrape off dried semen from the garment of the Messenger of Allah, right? And the semen that Aisha radiallahu anha, she's mentioning scraping off, was the result of sexual intercourse because it's an established theological issue that none of the prophets ever had wet dreams. Right? There's a whole psychology behind why, a whole theological debate. We're not going to go into that, but just know that the aqeedah of Ahl Sunnah wal Jama'ah is that none of the prophets ever had wet dreams, right? So if there's semen there, then there should have been intimacy between husband and wife. And if that is the case, then undoubtedly that semen uh, would also have vaginal discharge mixed with it, right? You can probably imagine how that would happen. So it should be taken into consideration that since the vaginal discharge is something normal and it mixing with the semen is unavoidable, accordingly, if this discharge had been considered impure, the semen would be considered so as well. Which actually is the case for us, for Hanafiya to begin with. According to Imam Shafi, ta'ala, the semen of a man is not impure. But even for him, if these vaginal discharges were impure, they would have resulted in washing becoming necessary, which is not the case. Right? The scraping should not have been sufficient to remove the impurity. It would have been necessary to wash the garment because impurity can only be removed by water. And accordingly, since Aisha radiallahu anha had considered sufficient to scrape it off, it means that a woman's vaginal discharge is pure. Now, scraping off money, that is another in Kitab al-Tahar that we study. And at that time, I guess because of their diet, uh, seminal discharges used to be very thick, not the watery kind that we see today. And you can literally scrape the entire thing off without it leaving any residue behind on the clothes. So the fuqaha agree if a man has their money in that state, scraping it off is sufficient. But nowadays, usually washing becomes necessary. But we know that vaginal discharge has never been that thick. It's never had that consistency to it. And so the entire discussion that we've had would completely apply in every era. So what we know from this is vaginal discharge is pure like other bodily discharges such as sweat, and this has been confirmed by physicians. And this statement from the book is very weird because if this means that vaginal discharge is pure, then physicians don't have the right to actually make that judgment because establishing purity and impurity of something is a totally shari'i masala, right? And so doctors with a case who are doctor, right? From the perspective that they're doctors, they don't have the right to establish a hukum. But if someone is trained in ulum sharia as well, then he's a doctor, that will be something different, right? So this is a confusing state in this book. Unless it refers to that vaginal discharge is like other bodily discharges in the sense that it doesn't have the characteristics of those things that are impure, like urine or feces, that would be something different. So that was ruling number one about vaginal discharge, which is what happened in terms of purity and impurity. The second is in terms of wuzu. And so the al-qawl al-rajih, the preferred opinion over here is that vaginal discharge does not nullify wuzu either. And the evidence for that is a hadith of Atiyah radiallahu anha that is mentioned in Sahih Bukhari. كنا لا نعد القدرة والصفرة شيئا, that we did not consider muddy or yellowish discharge to be anything of menstrual blood. And for those who are in Fiqh al-Hanafi, they know that this is not the case for menstrual blood. Any color is right? So that is dalil number one, which might not come up go work in all madhahib. Dalil number two is there is no evidence that vaginal discharge nullifies ablution or wudu. That is a dalil that can work in all madhahib. So it is well known that vaginal discharge is an issue, uh, the occurrence which is commonplace, what we call removal balwa. It happens, I would assume, to everyone. And therefore, it is not conceivable that Allah subhanahu wa ta'ala would remain silent on clarifying such an important ruling, or the Prophet al-Islam, for that matter, would remain silent in clarification of such a ruling, despite people encountering it so frequently. And lastly, adopting the opinion that wudu is obligatory for women who have this discharge, even though physicians state that it occurs frequently and repeatedly with all normal women. This will result in hardship, haraj and mashaqqa, right? While a woman can be vigilant at home and perform wudu for prayers easily, but when she's traveling or at work or doing umrah or outside the house, then this can become very difficult for her. Now, and other masala relate to splints, casts, and medical patches. If a part of the body that would normally be washed for ritual purification, either from minor or major impurities, needs to be covered with adhesive splints or medical dressings, and the need for that covering has been clearly established, which means that in order for you to recover, you're going to have to establish, especially when the wound, it's fresh. Putting water over it can make it more worse. And so you really have to cover it up in order for it to heal, such that moisture and air doesn't touch the wound, make it into a bacterial problem and stuff. That's what they mean when the need has been clearly established for you to cover it. Then wiping over that covered area satisfies the need for washing that part of the body. So in this case, purity is considered complete without the need to also perform tayammum. right? So if you wash the entire body and then just wipe over that place, and that. I mean, your tahara is done, you will need to do tayammum as well. So some people would say that you wash the other body parts and then you do tayammum for this specific body part. There's no need to do, right? And purity is tahara is not going to be nullified if the splint or the adhesive is removed. So by removing the bandage, it's not like removing al-khuf, leather socks, that your wuzu breaks. It's not the case. Removing the bandage uh, will not nullify your wuzu, your tahara, with the condition that your injury has not healed. If your injury has healed and then you remove it, which means that there's nothing stopping you from doing wuzu now, you're going to have to wash that body part at the very least. You might not have to do the entire wuzu, but at least you would have to wash that body part if your injury has healed, right? And the fuqaha have agreed on the legitimacy of wiping over splints instead of regular washing or wiping the limb in the wudu, ghusl or tayammum, based on need, obviously, because removing them will cause hardship and harm. And the ruling of wiping over a splint is applicable in other similar cases, such as wiping over a bandage, a plaster, a dressing, or medicine that has been applied to a wound and prevents water from reaching the skin underneath. Some form of maybe hard cream or something. Okay. So this is an extra faida from Ibn Uthaymeen, who was one of the top Salafi scholars of our time in Saudi Arabia. He says that if there's a wound on a part of the body that must be washed in ritual purification, then there are different scenarios or different stages for that. A is that the wound is exposed and washing does not cause any harm, then it must be washed. If it is amongst those places that needs to be washed during the course. B is that it's exposed, but it will be harmed by washing, but not by wiping over it. Then in this case, you're gonna wipe, but you're not gonna wash. C is if it's exposed and it will harm both in the case of washing and wiping, then you should do demo. And fourth stage is if it's covered within a decent bandage or something similar, then the person should wipe over the covering, and this will dispense the need for washing and then, right? So just wiping over the affected area is more than sufficient. Another tafri on that is that of blood loss or transfusion. What is the hukum for blood loss or transfusion? Well, the blood that comes out from other than the urethra or the rectum, and remember, this is according to the opinion of Imam al-Shafi'i, rahimallahu ta'ala, right? Because bleeding for them is non, does not nullify wudu. So blood that comes out from the urethral rectum, such as blood that comes from the nose, teeth, a wound, etc., does not nullify the ablution because there's no evidence for it in fiqh Shafi and probably fiqh Hanbali as well. By default, the state of purity remains unless there is evidence for its nullification. However, it is preferable and precautionary for the person to perform wuzu in order to avoid scholarly disagreement regarding this issue, especially when the blood that exits is a lot. The evidence for the aforementioned opinion is that's mentioned in a different hadith. For example, in Sunan Abi Dawud of hadith of Jabir ibn Abdullah, uh, about a story of a man of the Ansar who the Prophet sent with another muhajir to keep watch at the entrance of a mountain pass where they were camping nearby. So one of the mushrikeen who shot an arrow at that man 3 times while he was praying, and obviously if you're being shot by an arrow, you will bleed, but that Sahabi kept continuing his prayer, did not break it, right? Even when the blood was flowing. But this is obvious that it's very possible that that Sahabi was unaware of the hukum at that time. And that's why he keeps continuing praying, because there are other incidents within the hadith which tells us when the Sahaba came to know of that, they would perform wuzu as well. Allah Alam, this is more of a general fiqh discussion. Second evidence to support this opinion is the presumption of continuity. So this is a fiqh maxim, istishabul hal or baqa'u ma kan ala ma kan, keeping things as they were. So you keep a hukum that was previously established because you do not find sufficient evidence to go against it. So that's presumption of continuity. The default is that the state of purity remains in effect unless there's proof for the contrary, right? And since nothing has been reported from the Prophet about purity being nullified by bleeding, Nawawi says that it has been never been proven that the Prophet obligated ablution because of that. And like I mentioned, you could refer to Kitab al-Tahara in general fiqh for a full debate on the different opinions. And the third evidence that they quote is that the notion that ablution is nullified by bleeding is contrary to various narrations about the practice of early generations of Muslims. This includes statements of Hassan al-Basri who said, the Muslims have continued to pray even with their wounds. And bleeding is an assumption from the authors themselves. Allahu a'lam bisawab. So respecting whatever opinion you have, you being the doctor administering to the patient or the patient themselves, you could probably ask your attending, who's ever with you, according to whatever suits you best. Allahu a'lam bisawab. So this was the masala about bleeding from other than the urethra and the rectum. But when it comes to blood loss from the two natural outlets, then the book mentions that the preferred opinion in this case also is عدم نقض الوضوء, that wuzu is not invalidated. And this is because wuzu that is unanimously considered valid by scholars cannot be ruled to be nullified except by equal proof from the Quran and Sunnah or scholarly consensus. Moreover, since the issue is related to sick people, and the sickness is one of the factors that bring about alleviation and removal of hardships as stipulated by the Quran, and this gives support to the more lenient view. Hence, the preferred opinion is that blood flowing from the body would not nullify the wuzu. However, it is preferable to perform wuzu due to the scholarly disagreement on this matter and out of caution. This, I assume, and I think should apply to those sick people uh, for whom the wudu is either damaging, extremely painful, or very difficult. The cases and scenarios that we've mentioned previously, but if it's okay for them to do wudu, no harm, no foul, and no difficulty, then you're not going to get leniency just on the basis that you're sick. The sickness should be to a degree that it makes life difficult for you or it is harmful for you. Now, the validity of wuzu of patients who undergo dialysis, in which the blood is removed from the body, filtered, and then returned to the body, is not affected by the procedure, by the dialysis, and they do not need to renew their wuzu afterwards. Similarly, the infusion of blood into the body also does not nullify wuzu. Infusion of the blood does not nullify wuzu. That's pretty much agreed upon. If it does not lead to bleeding out. As far as dialysis is concerned, because you take things out of your body, blood and whatnot, according to Hanafi fiqh, it would break your wuzu. And dialysis is not something that you do every day. And so once after the procedure, there is no haraj in that person performing wuzu if aren't any other impediments to it. And so according to Hanafi fiqh, they would have to do wuzu. And other hukum related to at-tahara is the use of urinary catheters, right? And so catheterization is basically to insert a tube into the bladder through the urethra. And the reason you do that is to drain the urine into a bag that is placed next to the patient's bed. And so this usually, whatever urine is produced is discharged this passageway, and this doesn't require any action from the side of the patient. So especially bedridden people, they need this procedure in order for them to relieve themselves. The ruling consider these catheters is as follows. So whoever is in a continuous state of hadath al-asghar does not need to perform wuzu for each individual prayer. Such a person's wuzu is not nullified unless an other cause of impurity occurs than the one that is chronic, right? So this is something that is usually discussed in general fiqh in the masala of man bihi salisul bawl aw al at times. So an excused person who has a chronic illness that keeps a, a chronic impurity that remains with them. So for such a thing, every time you become impure, you don't do wuzu. But if any other reason that would nullify wuzu occurs, then obviously you have to do wuzu, right? So for example, a person who continuously excretes urine, salisul bawl, does not have to perform wuzu each time they're faced with this problem. However, if this person who had salisul bawl, they pass through or win, then they should perform wuzu because the reason for their wuzu being nullified is not their chronic condition. The fuqaha excluded a scenario from this ruling, and that is if the cause of minor hadath occurs infrequently, so it's not chronic, right? So for the most of the time, the patient does not experience it, and sometimes they do. Then, in this case, it's like any other naqid, naqid al-wudu, and the person must perform wudu. Evidence for this is mentioned in a hadith in the Sahihain, al-Bukhari wal-Muslim, of Aisha radiallahu anha, that Fatima bint Hubaysh radiallahu anha, she came to the Prophet and said, O Messenger of Allah, I'm a woman who experiences intermenstrual vaginal bleeding, istihada. So I am never ritually pure. Should I abstain from ritual prayer? And he said, no. The bleeding that you're getting is from a vein and is not menstruation. Therefore, when the menstrual bleeding comes, then abstain from the prayer, and when it departs, then wash the blood from yourself and pray. Right? So the Prophet did not command the woman with abnormal intermenstrual vaginal bleeding, istihada, to perform wudu for each prayer. Rather, he instructed her to follow the rulings of uh, menstruation during her period and only to perform the ghusl and resume prayer when her period was over. Outside of actual menstruation, it is not obligatory for her to perform ablution or wash her body every single time blood starts flowing. Therefore, the person who continuously excretes urine also does not have to perform ablution until they excrete something other than urine. Though for such a person who is known as ma'dur in Sharia, for the Hanaf, the ruling is that you have to make a new wuzu for every salah time. So once you made the wuzu for Asr, until Maghrib, you can do with that wuzu whatever you wish. It's not going to get nullified because of the chronic illness. But at Maghrib, you'll have to make a new wuzu. So for every new prayer time, a new wuzu must be made. Uh, the sixth tafri concerning Taharah are about the menstrual cycle disorders. Right? So the menstrual disorders, what that includes. So a woman who experiences abnormal intermenstrual vaginal bleeding will be of one of three categories. A, the woman with abnormal bleeding since the beginning of puberty. Yani she started off puberty with istihada. B, the woman previously had a routine and now she started extra. And three is al-mutahayyira, the woman who's confused, I who's unaware of when and how long she had her last period, and therefore has no clue what her routine was. Right? So she neither remembers her routine, how many days, and neither remembers when was the last time she had her periods. Right? And each of them has a different problem. As for al mubtadi'ah, the one who began with istihaza, with the moment she became baligha, for such a woman, she does not necessarily know that she's in a state of istihaza, right? Except by the bleeding continuing beyond the maximum duration of days. So in this case, what you do is to differentiate between what is menstrual bleeding and what is abnormal bleeding. Is one way to do that is to discern between the two different types of bleeding uh, through maybe color, for example. She's known as mumayyiza. So if a woman who is able to do that, you can actually tell whether this is from my haze or this is not from haze. Then she follows her gut feeling. She does studies of that. You some either do that by color, others can actually do it by uh, gauging the pain they have in their pelvic regions. And so they know by the pain that they're having that this is actually haid. These are my periods. And they can tell that my period have ended and this bleeding is probably something else. So Mumayyiza is any woman who can actually differentiate, discern between the two types of bleeding, then she will do what she thinks is happening with her. So regardless whether the duration of such a woman, the Mumayyiza, the duration of a menstrual period determined shorter than the longest possible. So let's say normally we would say she should assume that 10 is her cycle and then after 10 is istihaza. But if the Mumayyiza knows that until the sixth day was haze and afterward it's not haze, then she will go with 6 days as her line. But if she's not a mumayyiza, she doesn't know, then we will assume 10 days for her as being haze and after 10 istihad. The evidence for that is the hadith in which the Prophet's response to the question of Fatima bint Ubaysh is that The blood of menstruation is dark and recognizable. Also, the discharge requires ghusl, so we can't resort to judgment on the basis of physical characteristics, similar to the case of distinguishing money from mali, semen from preseminal fluids, right? They both have different characteristics. So menstrual blood and non-menstrual blood should also have different characteristics. Allahu a'lam bisawab, right? All right, you already mentioned this. The second kind is the woman who has a routine, right? So this woman who regularly experiences vaginal bleeding on certain days of the month, even if the duration of the menses varies, right? For example, if she experiences bleeding for 3 days in 1 month, 5 days in the second month, and 7 days in the third month, right? And then the cycle starts again, 3, 5, 7. Some might have consistently 666, which is very rare. Others might have a varying frequency of bleeding, different months, different days. So if this woman experiences bleeding that exceeds the maximum duration of the menses, then she can be of two types. Either she can distinguish between the types of bleeding, she's a mumayyiza, or number B, she's not a mumayyiza, she can't distinguish. In the case of the former, the mumayyiza, and she's not just a mumayyiza, she also has a routine as well in place. So for her, the hukum is that if the results that she arrives is based on her distinction between the two types of blood, and they're also in accordance with her routine, then obviously everybody agrees that she does exactly that. She follows her gut feeling because that is in line with what her routine was. So there's no ikhtilaf whatsoever in that scenario. However, in cases where the two conflict, her Ada says something, her routine says something, and her gut feeling tells her something else. The discretion she's making is pointing towards something entirely else. The preferred view is that she should follow her routine in preference to the result of distinguishing, because your ada is established by your body, and your gut feeling might be wrong. So when the two collide, for the woman who has a cycle and who also mumayyiza, she should follow her cycle and not her tamyiz. The evidence for that is a hadith by Habiba bint Jahash, who complained to the Prophet ﷺ about her abnormal bleeding, and he told her to wait from praying as long as your normal period prevented you, and then perform ghusl. After that, she started performing ghusl for each prayer, right? So that's what the Prophet said. So wait out your ada, whatever routine you had, and afterwards start praying. The hadith at the end mentions after that she performed ghusl before each prayer. Now that is a very difficult job to perform ghusl after each prayer. But the fuqaha in establishment that this was an act by Habiba herself. This was not prescribed to her by the Prophet ﷺ. Okay? So someone in such a scenario does not have to make a ghusl for every single prayer. Just wuzu is more than sufficient. Another piece of evidence for this is that a woman's menstrual habit is stronger because it cannot be invalidated, whereas the color of the blood, which is used for making for distinguishing between whether it's menses or not, If it exceeds the number of days of her regular period, it can also be a false indicator. For whatever reason, hormonal changes, diet changes, the color of the blood might change. So it's not 100% that she has a problem with this. Therefore, we will give priority to the stronger of the two indicators, which is al-'ada, her habit. Third piece of evidence that the ability to distinguish between the types of blood by color or odor can change due to women's age, diet, medication, psychological state, etc. Therefore, it is safer to rely on her menstrual routine as the criterion for judgment. Lastly, the ability to distinguish the type of blood by color or odor may differ from one woman to another, even with the same woman. Therefore, doctors and those experienced with such matters do not give this much consideration. And the fuqaha of Ahnaf don't give it any consideration. The category of mumayyiza does not exist in fiqh al-Hanafi. The second was the case in which the woman experiencing istihaza is not a mumayyiza, but she has an ada, obviously. In this case, if her bleeding exceeds her usual routine, but does not exceed the maximum days, which is 15 according to majority jurists and only 10 days according to the Hanafi jurists, then she is considered to be menstruating the entire time she is bleeding, right? So her Ada was 5 days and she bleeds up till the ninth day in Hanafi faith or 14th day in the other fiqh, then it'll be considered that she was bleeding all 9 days. But if she exceeds the 10th or 15th day, then we will consider her Ada to remain the same. For 5 days, until 5 days, she was having her periods. After that, istihada started. Right? We've studied all of this in general fiqh as well. And lastly, you have al-mutahayyira, the confused woman who had no pre-established routine, neither is she able to distinguish between the two types of blood. And so this mutahayyira can fall into one of three categories. Number one, the woman who forgot the duration of her menses, but remembers the time. So she doesn't know how long it was, but she knows whether it happens at the start of the month, the middle of the month, or the end of the month. So such a woman may know, for example, that her period occurs at the beginning of the month, but doesn't know how many days it lasts. So for such a woman, she should observe her period for 6 or 7 days at the beginning of each month, since this is usually the average. As indicated by the Sunnah that the Prophet said, observe your cycles for 6 or 7 days according to your best estimate, or according to Allah's knowledge, then form ghusl. That is one kind of woman. The second kind of mutahayyira is the one who forgets the timing of her periods but remembers the duration. She knows I used to have menses 5 days, but I don't remember if it was at the start of the month, the middle of the month, or the end of the month. For such a woman, she should observe her period for the duration that is her routine, starting from the time of the month in which she is most confident that her menses used to be. And lastly is the mutahayyira that who knows nothing, neither the duration of her periods nor the time of her periods. Such a woman should do her best to determine the start of her menses and then should observe her period for 6 or 7 days. Any bleeding outside that is considered istihaza. In other words, she actually makes dominant assumption of what might possibly have been her start date and what might possibly have been her duration. And based on that, she makes the decision. And inshallah, there will be no repercussions on that. Inshallah. Allahu alam. Bissalam.